of the interesting things is hospitals have had to put almost artificial prices. So they've had to put a price that's, I'll call it artificially high. So then they can negotiate with the insurance companies for a lesser amount. But what you have is a very convoluted pricing system that frankly no one really understands, and that the payer, the employer, is starting to get very frustrated with. I'm working with one large employer, and his question was, why is it that there's 7 providers of colonoscopies and they range from $4,000 to $17,000? Surely it can't be that much difference within a fairly small geographic area to provide a very similar standard procedure. You can't completely blame these healthcare delivery systems. They've been forced to create prices to solve many, many problems, including uncompensated care. So one of the big changes under health reform is going to be a transparency of pricing that's going to force the healthcare system to say, what is a true price? What is a real cost? How do we then compensate all of our providers and ensure we've covered our facilities? You know, one of the big changes under health reform is a significant budget for the federally qualified healthcare centers. So FQHCs exist to provide community care for those who can't afford care. So there's a sliding fee scale, often down to $2 or $0, where the folks who really can't afford care can come in and get good primary care. So as you see these federally qualified healthcare centers receive what will be truly billions of dollars, you're going to see hopefully the uncompensated care start to be reduced. You combine that with putting more folks under insurance, and you're going to have a greater leveling of pricing. I actually think it's going to be a very big challenge for our healthcare system to figure out what is the right pricing.